Hello viewers, this is Ulnar nerve story. Ulfat, playing the role of ulnar nerve, an acid attack survivor. I am Ulfat, a beautiful Muslim girl, belongs to middle class family. Ulnar nerve is the continuation of medial cord of the brachial plexus. Middle class, and here is the medial cord. I love music. Ulnar nerve is also known as the musician nerve, as it innervates most of the intrinsic muscles of hand which govern fine motor activity. My life can be described into first phase, second phase, and third phase. Ulnar nerve has its course in arm, forearm, and in hand. In first phase, I am first protected by my mother, I, A, then brother, B, and then Burkha, BB. Ulnar nerve in arm first lies, here you can see, first lies medial to the axillary artery, then medial to brachial artery, axillary artery A, brachial artery B, and then it lies medial to biceps and brachialis muscle, BB. In mid first phase, that is at the mid arm level, I forced to marry with the Sukabuddin Sheikh. Sukabuddin, S-U-C-A. And I cross Miss stage and turn into Mrs. In mid-arm level, ulnar nerve crosses medial intermuscular septum and come into dorsal aspect from the ventral aspect along with the Suka, that is the superior ulnar collateral artery. Here we can see that this is ulnar nerve and here is the superior ulnar collateral artery. Both altogether enter into the dorsal aspect. That day was a disaster when I entered into married life. On that day, an act of shamelessness, AOS, happened. Someone thrown acid on my face. As soon as ulnar nerve entered into dorsal aspect, entangled into arcade of Struthers, AOS. Arcade of Struther is a thin eponeurotic band in between the medial intermuscular septum and the medial head of triceps. My face was completely destroyed. I have restricted myself within a closed room, just like a tunnel. After that, ulnar nerve enter into cubital tunnel. Here is the cubital tunnel. After passing through this arcade of Struther, now it is inside the cubital tunnel. In that closed room, everything was scattered. Feka hua tha. Just like all my dreams, I was in depression. Cubital tunnel is formed against the depression on dorsal aspect of the medial epicondyle, converted into a tunnel by humero-ulnar arcuate ligament and flexor carpi ulnaris distally and humero-ulnar arcuate ligament proximally. Feka hua tha. In second phase of life, that is while in forearm, my husband took me out of this depression, even though he is feku and fayda pasand in nature, FCU and FDP. Ulnar nerve comes in forearm, crossing two heads of flexor carpi ulnaris, and now sandwiched between flexor carpi ulnaris superficially and flexor digitorum profundus in deep, and supply both FCU and FDP, that is flexor carpi ulnaris and flexor digitorum profundus, but medial half. In mid-second phase, my phaco husband moved aside and left me, and now I am exposed to unwanted atmosphere. In mid-forearm, flexor carpi ulnaris comes medial and ulnar nerve bounded laterally by ulnar artery. Here we can see first in the upper aspect of the forearm, this ulnar nerve is covered by flexor carpi ulnaris, but in lower aspect of the lower part of the forearm, this flexor carpi ulnaris lies medial and laterally it is bounded by ulnar artery. Now it's high time. I thrown off my pathetic, clumsy life and became bold. PCB, ulnar nerve, thrown off percutaneous branches. PCB, ventrally and dorsally at mid-arm level. Here we can see ulnar nerve thrown off palmar cutaneous branch and the dorsal cutaneous branch. Myself Ulfat. After throwing off this pathetic, clumsy life, I feel elevated. It seems I am entering into the third phase of my life through canal of gusto and zeal. Ulnar nerve enter into hand through Gyans canal. Here we can see ulnar nerve from the forearm enters into the hand through the Gyans canal, which lies superficial to the transverse carpal ligament. Gyans canal is formed by the floor transverse carpal ligament, roof volar carpal ligament. It is going distally up to the hook of hamate and proximally the pisiform bone. In third phase of my life, that is in hand, I finally hailed confidently. Hailed means cry enthusiastically and confidently. Okay. Finally hail and C for confidently. So in hand, ulnar nerve supply flexor pollicis brevis, deep head, hypothenar muscles, that is abductor digiti minimi, flexor digiti minimi, opponens digiti minimi. A for adductor pollicis, I for intraossei, that is 3 palmar and 4 dorsal intraossei. L for lumbricus, that is 3rd and 4th lumbricus. C, confidently, C for cutaneous innervation, that is the medial 1.5 finger and medial half of the palm, palmar aspect. And dorsal aspect is supplied by the dorsal cutaneous. But here we are discussing the main nerve which is coming through the Gyans canal. My physics, chemistry, biology, PCB is strong, which keep me elevated. Palmar cutaneous branch, that is PCB, passes superficial to Gyans canal and supply skin over hypothenar eminence. And another cutaneous branch, that is the dorsal cutaneous branch, which arises from the ulnar nerve at the mid-arm level, innervate medial 1.5 finger and medial half of the hand, dorsal aspect. Here we can see in green color, this is the innervation of ulnar nerve, area of ulnar nerve supply, sensory. Now what is the story inference? See, UG claw of crime. See, you can grab claw of crime. Clinical significance of ulnar nerve. C for cubital tunnel syndrome. U for ulnar paradox. G for Gyans canal syndrome. Claw, that is claw hand. In cubital tunnel syndrome, ulnar nerve get compressed within the cubital tunnel and there will be pain, tingling, numbness along the sensory supply of ulnar nerve. That is medial 1.5 finger and the medial half of the palm as well as on the dorsal aspect. There is pain, tingling and numbness. Patna. Ulnar paradox. This is a paradoxical situation. When ulnar nerve injury at wrist, at this level, flexor ditorum profundus not affected. So causes flexion of distal interphalangeal joint. But it will lead to more prominent claw. Whereas when ulnar nerve injury at elbow, that is at higher level, flexor ditorum profundus not working. No flexion of distal interphalangeal joint. But there is less prominent claw as it is against the rule that higher the injury and the higher the deformity. Another one is Gyans canal syndrome, where ulnar nerve get compressed within the Gyan canal and the symptoms are according to the site of compression. That is in zone 1 there is MS, zone 2 M, zone 3 S. That is in zone 1 there is motor and the sensory symptoms. In zone 2 there is motor symptoms and zone 3 the sensory symptoms. Very beautiful difference between the sensory damage in Gyans canal and the cubital tunnel syndrome. That is Gyan canal, only the palmar aspect, medial 1.5 and the medial half of the palm is affected. Whereas in cubital tunnel, both palmar and the dorsal aspect sensory loss. Because after the Gyans canal, there is the sensory supply of palmar aspect. Whereas the dorsal aspect, it is done by the dorsal cutaneous branch, which is thrown off in the mid forearm level. Claw hand deformity, in which there is flattening of normal arches of hand due to the atrophy of the intrinsic muscle, hyperextension of metacarpophalangeal joint and flexion in PIP and DIP, that is proximal interphalangeal and distal interphalangeal of 4th and 5th finger due to a supply that is medial half of the flexor ditorum profundus. And this is due to the flexor ditorum profundus as well as the lumbrical muscles. The lumbrical muscles get affected and it just opposite the pen holding situation, which is the function of lumbricals. Now unable to abduct and adduct fingers due to the loss of dorsal and the palmar interossei respectively. Now test for ulnar nerve. It is Wi-Fi. That is W for Wartenberg syndrome, in which little finger is permanently abducted due to the involvement of third palmar interossei. Palmar interossei, whose function is to adduct. So, loss of palmar interossei, loss of function, it will lead to abduction and extensor digiti minimi get overpowered. Another is Fromen's sign, in which when pinching a piece of paper between the thumb and index finger, thumb interphalangeal joint will flex if the adductor pollicis muscle is weak. So it's a test for knowing the efficacy of adductor pollicis, which is get lost due to the involvement of ulnar nerve and the person is flexing the thumb, that is taking the help of flexor pollicis longus, that is going to thumb. Thank you.